Hi everyone, Dr. Luke Peterson here with a knee replacement therapist. On this episode of the Knee to Know Show, we're going to talk about stairs and appropriate tips and techniques for going up and down stairs after knee replacement surgery. Hey everyone, so going up and down stairs after knee replacement surgery is probably one of the top concerns, considerations, things that people have questions about and are concerned about after surgery. And for good reason. It takes a good amount of strength, stability, balance, range of motion to effectively go up and down the stairs. So a relatively straightforward thing actually takes a good amount of physical ability. So this video, we're going to talk about just techniques to be able to go up and down the stairs the best way. So this is kind of that time during your recovery and rehab. You still have a lot of deficits, you have some weakness, you have some pain, stiffness, range of motion is limited. Just how to effectively be able to manage the stairs. And then in the next video tomorrow, we're going to talk about some ways to help to train and improve your ability to go up and down the stairs more easily, and with more comfort. So that'll be the next video tomorrow. All right. So first of all, just simple steps. Your day after surgery, or maybe a week after surgery, you're trying to go up and down the stairs. So what are some things to keep in mind? Well, one, if you have railings or something to hold on to, use them. You're weak, you have a lot of pain, you have range of motion, stiffness, difficulty swelling, all sorts of things going on. You're probably not as stable and as strong as you usually are. So use the railing, use the wall, whatever it is. Here I have the therapy table that I'm pretending to be my railing today. Use it, hold on to it, be safe. Now, the easy phrase, the common thing is up with the good, down with the bad. So basically what that means is when you're going up the steps, you want to lead with your good leg. Lead with the non-surgical leg, the leg you didn't have surgery with. So, for example, if I had a left knee replacement and I'm about to go up the stairs, so I go up with the good. So I lead with the right leg and then bring the left leg along as I step up. So up with the good, and then the other part of that is then down with the bad. So now as I go down the step, I want to lead with the bad, so lead with, in this case, the surgical leg. We're considering the bad leg. And so you're going to lead with that one first, step down, and then bring the other leg along. So again, up with the good, and then down with the bad. And the reason for this is you are using your strong leg, the non-surgical leg, to do the majority of the work with the step. So if you think about when you go to step up, the leg that comes up first, this one is the one you're going to push up with to come up to the next step. So use that leg with more strength, the one you haven't had surgery on, to push yourself up. And then when you come down, you'll notice that when you come down, the leg that stays on the step is actually the one that is still controlling your weight and helping you control that step down to the next step. So really it's all about using your strong leg, your good leg, to take those loads that you need to manage while going up and down the steps. Now a couple other things to keep in mind. So we talked about using the railing or the wall or whatever is next to you. Use that for sure. You also want to focus on making sure you're putting your whole foot up onto the step. Don't put just the edge, don't put your toes, leaving the heel coming off, because you get part of the way and you notice you're a little weak, and now you're kind of in this limbo area. You're going to increase risk of having something bad happen. Get your whole foot up there and then push up through that leg. Same thing coming down. don't put your toes over, keep them nice and close by on to the next step. Other things, just general good habits, good movement habits. So don't try your best to have good straight knees over your foot. Try not to cave in one way or the other. Try to keep your back up nice and tall, good posture. Don't kind of crouch or lean. Just general good movement habits as well are going to be helpful. If you are in a public place, if you're out somewhere, have good footwear. Same thing, even if you're at your home, try to have some footwear, or at least something is not as slippery, so that you are safe as well. So this is just general tips for being able to go up and down the steps during surgery, during your recovery from surgery. And the next video, again, I'll talk about some ways to train and improve so that you can start to use that surgical leg to go up and down the steps more comfortably, less pain, less discomfort. Thank you for watching, everyone. Tune in tomorrow for some more information.